White fungus is deadlier than black fungus. Amid concerns over rising cases of mucormycosis or black fungus in COVID-recovered patients, several cases of white fungus have been reported in Bihar. At least 4 patients of white fungus have been detected in Bihar's capital Patna. Notably, one of the 4 patients of white fungus infection is a famous doctor in Patna. An infection occurs when a microorganism enters a person's body and causes harm. The microorganism uses that person's body to sustain itself, reproduce, and colonize. These infectious microscopic organisms are known as pathogens like bacteria, viruses, fungi, etc. Fungal diseases are often very common in the environment. Most fungi are not dangerous, but some types can be harmful to health. Mild fungal skin diseases can look like a rash and are very common. Fungal diseases in the lungs are often similar to other illnesses, such as flu or tuberculosis. Previously called zygomycosis, mucormycosis is a serious and rare fungal infection caused by a group of molds called mucormycetes. These molds live throughout the environment. While a quick diagnosis and treatment can cure the patient, but left untreated, can prove fatal. Similar to the black fungus, factors such as severe diabetes, suppression of immune system, increases risk to people. White fungus pose dangerous to patients that have low immunity. The infection is primarily affecting people who are recovering from COVID-19. Medical experts consider white fungus infection deadlier than black fungus because the former impacts the lungs, along with other parts, such as nails, skin, stomach, kidney, brain, private parts, and mouth. The severe infection of white fungus impacts lungs in a similar manner as COVID-19 with chest pains and shortness of breath. Other symptoms can also be confused with another disease, which can lead to delay in antifungal treatment. Even though all the 4 patients in Patna had symptoms similar to that of COVID-19, they were not infected by SARS-CoV-2 or novel coronavirus. All patients were fortunately treated with antifungal medicines. But the infection is more dangerous as it affects the lungs, and the impact can be detected by performing high-resolution computed tomography. As per the CDC, Centers for Disease Control and Prevention, the symptoms of white fungal infection mainly depend on where the fungus is growing in the body. Small painless bump on the skin that can develop any time from 1 to 12 weeks after exposure to the fungus, which eventually grows bigger. For lung infections, symptoms include cough, shortness of breath, chest pain, and fever. Infections in joints can cause joint pain that may be confused with rheumatoid arthritis. Infections of the central nervous system can involve difficulty thinking, headache, and seizures. For protection against any pathogens, including white fungus, CDC has recommended wearing protective clothing, such as gloves and long sleeves, when touching plant matter that can cause minor cuts or scrapes. The disease can be diagnosed by either taking a small tissue sample or biopsy of the infected area of the body. Blood tests also sometimes help in discovering the infection. Treatment of white fungus is done through antifungal medicines and are not life-threatening. However, this changes if person contracts several disease and lungs are infected. Union of Health Ministry declared black fungus or mucormycosis as an epidemic. In India, a disease can be declared as an epidemic by making it a notifiable disease under the Epidemic Diseases Act, 1897. This movement will mandate all government and private hospitals to follow ICMR's guidelines for screening, diagnosis, management of mucormycosis, and to report all such cases to respective chief medical officers. Thanks for watching. Follow us for more.